Yeah, I appreciate a doctor that can practice what they preach. There are few
Yeah,
out there, right? And
thank you.
another way you do that is through your sleep routine. You're
Mhm,
asleep by about 9:30 or so. You wrote
mhm.
4:30, you're up, seven
Yep.
to 8 hours of quality sleep. But so many people suffer from poor sleep. And it's not just poor sleep, it's poor positioning. They wake up with aches. They're waking in the middle of the night. You talk a bit about that, especially how it deals with the spine and different ways to sleep. Can you give some recommendations for people that do have aches? I found myself sometimes in different beds in different areas when I'm traveling, wake up with some hip pain and things like that. Just like I know a lot of people lower back pain or just others. What recommendations do you give that I know were in the book?
Good question on sleep. So a lot of people I find, why is that important? First of all, is because if you're contorted in a bad sleeping position, it pre-stresses your body. So for
Mm-hmm.
instance, a lot of people I find sleep like this, their hand under their face, and then they try to go out to their workout routine and do push-ups and planks. Well, their right arm's already kind of, in essence, pre-tightened. It's pre-stressed. So now when you put stress on a pre-stressed area, you're going to get an injury. So in essence, that's why that's huge, is because people you see, again, patterns. People, I find a lot of people sleeping on their stomach and their side stomach. No one taught them how to sleep correctly. So you put a body pillow in there where they're not allowed to go on their stomach, and you're teaching them in the middle of the night that the pill is there for a reason to keep them from rolling over on their stomach. So it keep them on their side or on their back, and it keeps the three curves I said earlier about those three spinal curves in a shock absorbing position, not in a compromised position. So a lot of people sleep compromised, and over time, that's going to have consequences. And if you can sleep more on your side or on your back, hands away from the face, and in the sleep chapter, we talked about TMJ. A lot of people get
Mm-hmm.
TMJ, which is the most misdiagnosed condition I've seen in 42 years, because it could create a lot of mental health issues. And why I'll post again on Instagram, another it happens so often. A lot of people are just like this, and they
Yeah.
twist their jaw, and that affects superficial temporal arteries, which affect oxygen flow. And I say in the book, excessive yawning means your brain's trying to get more oxygen to the brain. So that could be a TMJ. Not to say it happens to everyone, but I look at that regularly on people and how their scalp is and how tight that is. A lot of people breathe incorrectly at night. I recommend mouth tape in the chapter, maybe to get used to breathing through the nose more often, change your sleep angle, raise it to 30 degrees to get less resistance on the lungs, so you can get better airflow in. And then train your body a little bit at a time in little progressive steps. And then your body gets used to that new way of doing things. And I recommend sense or stimulate the sense of smell, waves, oceans, raindrops. You could put apps to help calm you. Anything to help calm you sleep is great. I said the scalp massage. And stretching before bed puts you in the present moment, because the brain doesn't want to be in the present moment. It's always looking to protect you. So it wants to go to the future and the past and the future and the past. So if you could teach people to be more in the present moment, where they could do present time activities to calm their brains, pickleball, golf, stretching, cooking, gardening, these factors, archery, weight training, running, it keeps the brain in this present moment. And stretching before bed, you'll say, oh, wow, this is really tight. Oh, and then crawl into bed after you do foam rolling and stretching and go to sleep and good quality sleep. And if you do that, easier said than done. But if you add these other ways to improve your sleep that I mentioned in the book, it's and sleep posture is one of those. So you can get off your stomach, so sleep on your side or back. You'll notice a big difference with less aches and pains in the morning, and you'll notice better quality sleep where you're not as stiff and sore, and you're going to get up with a little more vibrancy, a little more energy, which hopefully you get outside, you go for a walk and start moving, as we know is all helpful for your health.
Yeah, no, there's so many recommendations in this book. That's why it's wonderful. And they are these kind of small implementable recommendations that anyone could do one at a time to optimizing their health in this Kaizen small win every day approach.